Good Thursday afternoon. I am Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness at Knox County Health Department. Our moment of gratitude today is dedicated to our servicemen and women. We are especially thankful to those in the Army and Air National Guard who have assisted us in several of our testing events. The coordination of these testing events has been a real team effort, and we are grateful for these men and women for continuing to serve our community as they are the ultimate public servants. Additionally, we're also thankful to their families who have supported them while they've been away from home diligently serving our community. Moving into our local situation, we have 323 confirmed cases of COVID-19 in Knox County. Additionally, we have 5 probable cases. 283 of our cases have recovered. 39 individuals have been hospitalized at some point in their illness. And currently, we have 2 Knox County residents that are currently hospitalized. We are very thankful that we have no additional deaths due to COVID complications at this time. Now, to talk a little bit about the virus as it relates to the reopening. With phase 2 set to begin next week, our community will continue to move further into our reopening plan. We are encouraged that our data supports this progression, and we will have more industry-specific guidance available tomorrow. But today, I want to spend a few minutes talking about the virus itself and the responsibility that all of us have in reducing transmission. As it relates to the virus, it's still very much a part of our community. The pandemic is not over, and the rules of the virus have not changed. So today, we'd like to reiterate some of what we know about the virus and how best to protect yourself and your loved ones. COVID-19 is a respiratory illness, and it's thought to spread easily through direct person-to-person contact when an infected person coughs, sneezes, or talks. As a reminder, close contacts means people within 6 feet of each other for more than 10 minutes. COVID-19 is a novel disease. That means it's new. So there is still a lot being learned about how it spreads, but touching surfaces or objects that have the virus on it, like doorknobs or keyboards, is not thought to be the main way the virus spreads. Again, it's that person-to-person contact. The virus may also be spread by people who are not showing symptoms. That further stresses the importance of wearing a mask when in public. On that note, we've seen some comments on social media that seem to denote that mask wearing is a sign of weakness or control, where we think it's actually a sign of compassion and kindness. Wearing a mask protects the people around you, your family, your friends, your coworkers. While you may be healthy and not at high risk from the virus, the people around you may not be. Wearing a mask is letting those around you know that you care about their health and their safety. Wearing a cloth face covering, physical distancing, hand washing, cleaning surfaces, and staying home if you're sick are the 5 core actions that we currently have in place that will continue to be critical as we move into phase 2. These core actions are based on this virus, how it spreads, and how we can reduce transmission. As we open up more places, it will be even more critical that we all follow these guidelines. Remember, it takes all of us to keep our community safe and happy and healthy. That's what I was supposed to say, but happy too. With that, I'll open up questions.
All right, any questions, please go ahead and submit them now. From WBIR, Memorial Day is coming up, lots of people gathering. Any tips for how to do so safely?
Go ahead, keep going.
And they just wanted to ask specifically, is it safe to be out on the lake, for example?
I think, again, we'll go back to those five core principles. So making sure that you're in small groups, trying to stay with your households as much as possible, because it's the intermingling that gives us an opportunity to spread virus between different people. 6 feet apart is always important. Wearing a mask. Again, washing your hands frequently, disinfecting surfaces, all of those things. Don't go if you're sick. All of those things can help us, especially as we get, everybody's going to be excited to be out over Memorial Day weekend. We want to continue to do those things.
his follow-up is specifically asking if it's safe to be on the lake and if there are some scenarios that are safer than others, and if you can give any examples.
Well, I mean, I think if you can do those things safely on the lake, on the boat, so you have a small group or you're staying with your family, I think that's great. So what the safer options are is to try to stay within your household groups and then practice all the social distancing and all the other things that we recommend. But there's not one single activity that we would recommend over others, just ones that allow you to practice social distancing is probably going to be the best thing moving forward.
From the Sentinel, when will it be safe for schools to resume activities like sports practices? Are there any precautions they should take if practices start back up?
Yeah, again, the same core principles will apply to schools and sports. More information will be coming on our phase 2 reopening guidance tomorrow. And there's more information available from CDC on schools and youth sports that we would point you to look at as well.
From WATE, with the CDC now saying that COVID-19 does not spread easily via surface touching, will any of Knox County's guidance change when it comes to frequent disinfecting or the like?
No, I think it's still important that people do disinfect frequently because it's still a possibility of risk, and that people are washing their hands frequently and disinfecting. It doesn't take it away. We just want to make sure that people also understand that it's that close contact that we're really looking for. And that's where the mask wearing and not going out when you're sick and all of those things also come into play. But it doesn't negate the need to disinfect and wash your hands and do all of those things.
Next question from WBLT. They say it's from a viewer. They ask, how can I get tested for antibodies?
If you want to get tested for antibodies, I'd suggest you talk with your provider. Some of them are doing that. We are not doing that at this time, just because, again, antibody testing right now is recommended more for surveillance, so kind of research purposes, not a great tool at this point for individual testing and decision making based on those tests. So, but you can talk to providers. There are some doing it.
From WBIR, we've seen articles talking about how it's difficult to convince kids to social distance.
Mm-hmm.
Any advice for parents on how to explain why it's important to their children?
Yeah, I mean, I think having really thoughtful conversations. I have 2 little boys at home, and we've had to have this conversation with them. And I think just explaining, just like with all germs, that we want them to stay safe and all of the things that they can do to protect themselves, and that this is a new normal moving forward, and answer their questions if they have concerns, but be as straightforward as you can and honest about this. It's the same thing as we tell you in flu season to wash your hands and try to stay away from people and stay home when you're sick. So it's just a little bit increasing those messages now.
From the Compass, what has contact tracing indicated about the compliance with social distancing guidelines?
Ooh, that's a tough one. So I'm trying to think of what you're getting at. If you might need to provide a little bit of clarification, but most of the cases that we're seeing are related to those close household contacts. If we are seeing secondary cases, which is a good thing. So that just does show that we're not seeing a ton from other areas that we can connect to other methods of being out in public or that type of thing. Most of it's typically around people you're spending a lot of time with. So your whole close household contacts or maybe people you work with. I hope that answers your question.
Let's see, from WBLT, I believe some residents in the Farragut area have expressed concern about 5G towers being installed in their neighborhoods. Can you explain what effect this could have on their health and what they can do to stop the spread of false information?
Yeah, I can't really talk about the effects of 5G on your health as it relates to COVID. I know that's pretty much all been debunked in the science and the research and the data. And with regards to any other health effects, you need to look that up. But in general, go to those reputable sources that talk about what the risk is for this. So the CDC, the Tennessee Department of Health, talk to your provider, World Health Organization. Make sure that you're getting information from those places. If you see things circulating on social media that just don't seem to fit, and make sure you try to validate what their sources are.
From WATE, will COVID-19 demands affect the health department department's usual summertime work, like mosquito testing or spraying for West Nile virus or other activities?
We are currently, as we have been since the beginning, operating in our what we call our continuity of operations plan, which does reduce some services. A lot of our services have been going on, but we're evaluating that. And as the community begins to reopen and do more things, we are as well. So all those decisions will be made moving forward. But as we go forward, we'll see how we need to open those things back up.
From News Talk 98.7, of the 323 confirmed cases in Knox County, do you know how many of them wore a mask on a regular basis? If so, what's the number?
I don't know the number of that. And that's a really good question, though. That's not one that we're capturing regularly.
From WBIR, it's summer camp season. Do you have any guidance for what's best for summer day camps? Should they wait to open?
Again, more guidance is coming with phase 2. That'll be out tomorrow, that has specifically what's allowed with day camps and what's not. So ask you to give us one more day to get all that firmed up and ready to be released. And there is some guidance also on CDC's website about day camps as well, if you want to look at that. That's there now.
Any further questions, please go ahead and submit them. This next question is from WBIR. They say it comes from one of their viewers. She asks, how many new admissions to the hospitals for diagnoses other than COVID-19 have tested positive for COVID-19?
Okay, sorry, I had to think through that. We aren't capturing that level of data. We know, and it's in our benchmarks that come every Friday, how many cases there are in the hospital. So how many positive there are in inpatients, whether they're in ICU or if they're on a ventilator. But we don't have that level, but I would refer you to the hospitals to ask that question.
The follow-up question is, if you are not tracking that currently, do you intend to start tracking that as hospitalized cases of COVID-19? Or would those people who test positive in the hospital count as hospitalized cases?
Yes, if you test positive while you're in the hospital, you're still counted as a hospitalized case because you have it while you're in the hospital, which is how we try to phrase that. So those numbers already get counted. So if somebody does test positive, it's already being looked at that way. The other way to look at that is we do look at if people are asymptomatic and that kind of thing. And we've provided that information in the past. I think right now, the overall rates around 10% of our cases have been asymptomatic as of yesterday's data, about 31% of our active cases. So we are seeing asymptomatic transmission. And again, that goes back to our 5 core principles and why we ask they continue to wear masks and do all of the other things, practice that 6 feet of social distancing as much as they can. So we're not continuing to spread it.
From WATE, bars are allowed to reopen, but without bar service. Can you elaborate on how that will work?
We'll talk about that more again tomorrow, and there'll be more guidance in the phase 2 reopening plan.
From a WBLT viewer, when will it be safe for high-risk individuals to return to work?
So I really think that's that individual question, and they need to think about what is at risk for them, how they're high risk, what's their work situation. Are they able to stay away from people and maintain social distancing and do all of those things? But we do ask employers to consider that, and that the individuals consider that as they move forward, because again, COVID-19 is here and it is a risk in our community and it's not going away. So I can't say that there's a date, in the near future or tomorrow that means that a high risk person is not still at high risk of catching and getting complications from COVID.
From WBIR, can you help us understand how the phase 2 guidelines issued tomorrow came together and who was involved?
I'm not on the task force, but there's a task force that provided input based on surveys that went out to individuals in the business community. They gathered all of that and went through that along with current guidance that's out from a lot of different places, CDC, and Tennessee Department of Health, and looked at all of that to compile the recommendations together. And they can talk more about that tomorrow on the full process.
From the Compass, to follow up about contact tracing,
yeah.
I was trying to find out if contact tracing indicates that people are following guidelines. In other words, are people who are positive getting in contact with more and more people?
Yeah, we're not seeing that. So I appreciate you providing that clarification. Again, for the most part, The people that are testing positive, that are contacts to cases, are those close household contacts, or maybe people that they work with all day long. We are not seeing a lot of community type, just generalized cases. Doesn't mean it doesn't happen, but the vast majority are typically, again, where we go back to those close household contacts for the most part.
From WBIR, has KCHD been getting questions from churches as they prepare to reopen? And what are some of those questions, and what advice do you have for churchgoers and pastors?
Again, for the church guidance, that's from the state. And so any questions that we are getting from churches, we're trying to refer to the state and their guidance. So I don't have the full details of those questions, but that's definitely one that lives in the state realm right now.
Any other questions? Please go ahead and submit them now. And just to follow up, we received a clarification from one of the questions about the 5G towers in the Farragut area. We now understand that is more about radiation, not coronavirus.
Yeah, I can't speak.
So Charity, you can't speak to that directly. So just wanted to clarify that. Okay, because there's no more questions being submitted. Thank you all. We appreciate you joining us, and we will see you tomorrow at the same time.